Hi everyone, and welcome to another webinar by Grad Australia. I'm Emily and I'll be your host for today. So before we begin today's session, I'd like to begin with an acknowledgement of country. So as we gather for this meeting, physically dispersed and virtually constructed, let us take a moment to reflect the meaning of place, and by doing so, recognize the various traditional lands on which we do our business today. We acknowledge the elders, past and present, of the land we work and live on, and their ancestral spirits with gratitude and respect. We extend that respect to Aboriginal and Torres Strait Islanders people here today. I'm joining the call from Brisbane, which is the traditional land of the Turrbal people. So to introduce myself again, my name is Emily. I'm one of the webinar hosts for the Career Talk sessions by Grad Australia. So these are sessions that we host on a weekly basis. We host them on all kinds of topics for all industries, just to help you fast track your graduate career and help you in university. And for those of you who don't know what Grad Australia is, we're a graduate career site where you can explore and get a backstage pass to see what it's like working with graduate employers. You can also apply for programs that really suit you. And when you sign up, you actually get notified of open applications and opportunities that you can apply to. So it's a really great site for fast tracking your career and, just getting started, fresh out of university and during university. So today's session is on pharmacy, your guide to internships, opportunities, and careers. And we actually have 3 guests joining us today from Ramsay Health Care. So I'm just going to give a little bit of an introduction to our speakers. So the first speaker we have is Alicia Simpson. She is a pharmacy practice and learning manager. And Alicia she looks after education, quality and pharmacy services for both the hospitals and community pharmacy teams. After graduating from UQ, Alicia has worked across Ramsay hospitals and community pharmacies for the last 15 years. And during her time as a hospital pharmacist, Alicia completed a postgraduate diploma in both e-healthcare and clinical pharmacy and became HMR accredited. She also trained as an oncology pharmacist and led the electronic integration of CHARM with the Baxter project to ensure the safe and efficient ordering of chemotherapy for our Ramsay teams. And Alicia is passionate about integrating technology with practice to ensure our teams provide excellent quality healthcare to our consumers. So that was Alicia. And then we also have Ella Raguz, and she is the National Clinical Educator of Pharmacy. And, Sorry, one second. I seem to have a double up. I'll let Ella introduce herself. I seem to have missing Ella's bio. So Ella, can I just hop over to you for you to give a quick introduction to yourself? I seem to be missing your bio.
That is all good. Nothing too exciting, really. So I'm Ella. I graduated from UQ back in 2016. I completed my internship at the Launceston General Hospital in Tasmania. Officially lived across every state along the eastern seaboard now, which is a very cool part of my job currently. After my internship, I moved to the private sector with Ramsay and started working at Greenslopes Private Hospital in Brisbane. And I underwent the residency program there, which is a program run by Society of Hospital Pharmacists. So that's a 2-year program that I completed. And then I went on to do my master's. Just during my residency, really loved oncology. That was a huge passion of mine. So I went on to do my master's in 2020, finished that in a year. And now I am working as the National Clinical Educator for Ramsay Pharmacy, which basically forms part of Alicia's team. So I'm part of the pharmacy practice and learning team. Within that role, look after a couple of different things, but mostly education. I guess it kind of speaks for itself. So helping bring on new staff, look after all our interns, residency programs, and basically getting people to where they want to go in their career, making sure that they're trained up. And I've also, as part of that education, I love education and I love educating myself. So now I am a PhD student as well. So I'm doing my PhD on pain management in pregnancy and postpartum.
Awesome. Thanks, Ella. I seem to have found your bio just as I passed it over to you. Sorry about that. Anyway, continuing on, we also have Jasmine Ardeshiri, and she's a pharmacy intern. So Jasmine graduated from UTS in 2021 with a Master of Pharmacy. She's also received a bachelor's degree in medical science from UTS. And as part of her university work placement, Jasmine has joined the Ramsay Pharmacy Miranda team in 2020. And after demonstrating a passion and drive for pharmacy, she was offered an internship position. And currently she's completing her training at the Miranda community site in late 2022. And so during her time with Ramsay, Jasmine has become a trustworthy, passionate, and crucial member of the healthcare team. And Jasmine is on course to continue her career with Ramsay Pharmacy, joining Ramsay's North Shore Hospital team in 2023. So that was a little bit about our speakers. Just to give you guys kind of an understanding of today's session, we have a bunch of pre-prepared questions that we'll also go through to make sure you're getting all the information you need. But if you have any questions, this is absolutely the time to pop them in the comments and, ask them to any of our speakers. So feel free to, comment any questions you have, and we'll make sure we get to them. I just also want to pass it over to Jasmine to share anything else about herself before we pass on to Alicia and then continue with the session. So Jasmine, is there anything else you would like to say other than what I've introduced?
No, I don't have anything else to say. The only thing that I can say is be patient, guys. You will get there, and the working hard, it will eventually pay off. So we all went through that hard time before when I was doing my final semester at uni, and I remember I had multiple breakdowns, but now I'm a lot happy, and I'm so grateful that I pushed through it.
Awesome. Thanks, Jasmine. And Alicia also has a slide to share. Oh, 1 second. There we go.
Great. Thank you, Emily. So I've got a bit of a slide around Ramsay, who we are, where we come from, where we are in Australia, and our careers. And then we'll have that Q&A more specifically and probably less formally. So I thought make sure we introduce what is Ramsay Health Care and what is Ramsay Pharmacy for you. So Ramsay Health Care is a multinational business. We're in 11 countries, but in Australia, we have 100 pharmacies, 60 of which are community pharmacies and 40 are hospital dispensaries. So we work for the largest operator of private hospitals in Australia, and that's across all states except for Tasmania at the moment. We have the franchise network of community pharmacies, which Jasmine works in, and we sit in that big corporation with over 30,000 employees. Ramsay has some fantastic ethos within the business. People caring for people is how we all practice and work. But we also make sure that we not only care for our people, but we do caring for our planet. So we do lots of things to reduce waste, especially even medication waste, and recycling and all those types of things. And then we also care for our community. So making sure that we have philanthropic presence within our teams, and in our pharmacy teams, we make sure that we sponsor programs like Are You OK Day. We do Movember. We've done Dry July, where we've looked at upper GI cancer therapy. Make sure that we have some internal processes where we care for our community and make sure that responsibility stretches beyond just connecting with our patients and our practitioners, but to our community. Ramsay Pharmacy Group is a fairly large group. As I said, our facilities, we have about more than 1,200 team members. We've got a conference coming up in October where 250 of our team members will attend on the Gold Coast, which is exciting. We will all see each other in person. We're dispersed across 4 states and our community and hospital dispensaries. But we do have team meetings online, which COVID has brought to us, and events like this, where we can all sort of see each other and meet each other, where years gone by, we would never have known what each other looks like in person until we met in person. Our clinical pharmacy support our hospital processes, And our community pharmacies are heavily involved in the vaccination programs, COVID vaccination, flu vaccination, and we're looking at injection sites as well. We have a broad array of careers and career concepts within our pharmacy team, within that whole huge Ramsay Health Care broader network. And you can see there's sort of two main circles. We have our community pharmacies in green and our hospital pharmacy teams in purple. And of course, they intersect and are supported by our pharmacist support network. So we have lots of different career pathways, professional care, aged care, immunisations, and then into our hospital sector, cancer care, clinical trials, mental health. They're supported by area managers. And then, of course, in yellow is our pharmacist-led support team. So my job title sits in there, and so does Ella's. But we have, education, systems managers, aged care consultants. We look after all of those from a pharmacist-led support team. So very different structure to the public sector, but also very different structure to some of your community pharmacies that don't have that purple circle within their career pathway. And as you heard Jasmine say, she's moving from the green over to the purple with a slight transition, just driving to a different workplace for the day, but obviously will follow a different sort of career path with regards to becoming a clinical pharmacist, then do the residency program and specialize if she chooses, or be a career clinical pharmacist without any change. Go up to our COO and our CEO level, who pharmacists, and then we report into group-wide Ramsay Health Care, which is at that huge billion-dollar business size of company, which is super exciting because there's lots of opportunities and ability to expand. So those career pathways aren't set in stone. They're just what we have currently. And we see the embedded aged care pharmacists coming on board, and lots of roles with the expanded scope of practice for our pharmacists with regards to injections and vaccinations, and hopefully prescribing with the North Queensland prescribing trial that is currently happening. We have one of our community pharmacies participating in that as well. So we have sites all across Queensland. As you can see, lots are concentrated in that southeast corner. We go all the way from Cairns down to Tugun, so covering Queensland quite well with our hospitals, community pharmacies. Then in New South Wales, starts at Pottsville all the way down to Albury across that east coast. And Jasmine's site sits in that little 4 box where there's lots of concentration around Sydney. But we do have the Wollongong and the Nowra sort of area as well. Then in Victoria, it's mainly around CBD and Ballarat, as well as along the border with Border Cancer, Shepparton, Albury, Wodonga, where we have hospital facilities that have specializations like cancer care, and we are able to support those regional internships, as well as support the careers along the way for all of those hospital and community pharmacists who live in that regional area. Our intern program is unique. It's combined with the greater Ramsay group. Has about, this year has 600 or so nurses, 40 pharmacist interns and 60 allied health graduates. So everyone works together. They do sessions with the Grad Plus program, and that goes on to a second year, which is a fellowship year for our pharmacy teams. That is your first year as a registered pharmacist. So that big transition, we help you through that, not only with education, but with career support, CPD support, and some mentoring. We provide national tutorials. Of course, we do those virtually at the moment, but that's weekly for our interns to help prepare for exams, but also prepare for life and pharmacists becoming a pharmacist at the end. And our clinical support includes that from our clinical educators, and we have a couple of APRA examiners in our workforce who help our interns work through what it's like to practice those exams, because they're actually the ones doing the examinations. Unfortunately, they don't get to be yours, But their knowledge and experiences are very much welcomed by the current intern cohort. So thank you, Emily. That's a bit of an overview of us, and then might be easier to answer some of those other questions now.
Awesome, thank you. I'll remove the slides. Cool. Okay, so we'll get into some questions. As I said, if you guys have questions, definitely pop them in the comments, but we'll start off with our first question. So the first question I have is, how did you get into the role you are in now, / what has been your career journey? And this is for Alicia and Ella. So maybe Ella, did you want to start with this one?
Sure. How did I get to where I am today? I think a lot of it is to do with yourself and just being open to opportunities that come your way. Pharmacy is a fantastic industry, and there's so many new things happening all the time. We're constantly having, a change in our scope of practice. So really, I guess all I had to do was just put my hand up for things and say that I really wanted to do that. Honestly, the way that I got into my job was I just had a chat to Alicia one day and said I'd be really keen to take on something like that. And that was it. And I think Ramsay is an excellent company in that we do take that into account, and we try and keep in touch with people and sort of say to them, where do you see yourself going? And, how do we help you get there as well? So a lot of it's been, just saying yes to things. But also I think I've always been a very driven person, not just career-wise, but like I said, education-wise, and trying to make myself a better pharmacist all the time. So doing things that I know will not only help my everyday practice, but allow me to help other people as well. So things like, pursuing a master's degree and now doing my PhD. And as you know, research is one way where we can actually help our wider community by participating in it and, putting that out there. So to improve our practice and things. So I think, yes, mostly it comes down to a personal level and how far you're prepared to go and how hard you're prepared to work as well. Knowing that, if you just say nothing and keep doing your job without putting your hand up for things, then honestly, sometimes you won't get noticed. So it's about putting your hand up and saying, I really want to do this. What can I do to get there? And, doing things and saying yes to things and opening up those opportunities means you'll get to figure out what you actually like to do as well. So if I didn't do the residency program, I don't think I would have had the opportunities like, experiencing oncology or like ICU and all of that. And there's no way that I would have ended up in this PhD career path as well. So just that would be my main thing. Working hard, saying yes, putting your hand up.
Awesome. Thanks, Ella. And I'll pass over to Alicia.
Well, I'm not really no different to Ella in that working hard and putting your hand up prerogative. So I sort of started career across multiple settings in pharmacy. So I had opportunities in aged care, doing nursing home reviews, at community pharmacies, and then off to our hospital dispensaries that are now all Ramsay facilities. I worked my way up from junior pharmacist to pharmacist in charge to area manager. Did a few degrees along the way because I felt like I didn't have mentors at that time. We didn't have a pharmacy practice team. We didn't have national educators to help. So I decided to use external education to help me pursue some of those needs that I felt I had with regards to clinical information. And so I then excelled within that space, in that clinical and online healthcare space. And then a couple of years ago, said to our CEO that we really need to have a pharmacy practice and learning team to be able to manage our staff and our practices and processes. And so here we are today. I got to create my own team. And we now have 7 of us in the team. And without the team, we probably would have struggled to get through COVID and all of the changes, not only in legislation, scope of practice, immunization programs, the practicality of doing paper audits, and we moved to electronic auditing, having everyone have an iPad. So you can see Jasmine today because we have iPads sitting in our community pharmacy so they can communicate well. So all of those things came from us having that extra support team that wrapped around the operations team. And we've been super successful. And it's a fantastic career path that I've been able to have, and lots of people will be able to have that journey now.
Thanks, guys, for the little backstory. So let's move on to our second question, which is on what are the opportunities for interns to continue to develop and learn once they commence employment? And this is to Ella and Alicia again. So I'll go back to Ella first.
I think we're pretty lucky within Ramsay in that we do have what we call the fellowship program. So not only do you do like your intern year with us where we support you through that and have things like workshops and the grad days with the nurses and allied health, but as soon as you graduate, we do have a fellowship year. And that is all about, I guess, supporting you through that first year of registration, which can be a bit of a weird time because you've had support all through uni, you've had support through your intern year with different, sort of goals in mind. Okay, let's get through our exams and let's get through this. This is the next step, to sort of all of that being taken away all of a sudden. So with our fellowship program, we do offer a lot of, I guess, support during that time to not only get you through it, and because it is a weird time, but also to point you in the right direction of where you do want to go with your career. So we do offer like one-on-one mentoring, and that can be, with myself or maybe a particular person that you want to see as your mentor. So it might be a community pharmacist that you really look up to, might just be someone that you just really admire where they've gone throughout their career and things. So we try to set people up with that mentor, just to sort of guide them through, okay, where do you want to go? How do we get you there? Is it like Jasmine saying, I'm currently working in community, but I really want to experience the hospital side of things. It might just be organising a couple of days for you to go out and experience that hospital side of things. And if you really do like it and if you want to pursue that, and just, I guess, tailoring your CPD as well to how you can get to where you want to go. So if you're particularly interested in things like vaccinations, making sure you're trained up for that, that you've, maybe go on to even extend that practice to like doing an injectable medicines course. If you're interested in HMRs, getting you accredited for that and pushing you along there. So we are lucky in that, in that first year out, we will really support you to where you want to go. And I guess it doesn't stop there. After internship and after that fellowship year, is that because we sort of created those relationships with you and that connection, that we always, I guess, you have that comfort of knowing that you can reach out to people and saying, hey, I'm not enjoying this anymore, or I'm really liking this, but I want more experience in it. And you can keep doing that throughout your whole career with Ramsay, and we'll keep pushing you in the right direction and getting you what you need, I guess.
Perfect, thanks. And we'll go to Alicia.
There's not a whole lot to add to Ella. However, just you've got an awesome degree, which means that your career isn't static. So you have a degree that allows you opportunities in lots of different workplaces and settings. And most of them are supported by Ramsay Health Care. And so if you're not happy in one, or you think that there was something missing, or you'd like to explore a different pathway, and then we have those opportunities within the business. So you don't have to look outside of the business. I think that's really exciting, unique, and good opportunities for you. So, even if it's not at the first year that you decide to switch between community and hospital, if it's in 15 years' time, the opportunity is absolutely there to do so within any of the states that we operate, or even create your own role like I did.
Thanks so much. So Ella, I have a question for you now. So the question is just on what are the different areas or career paths within pharmacy, and where can a pharmacist go beyond their internship?
So many places. I think Alicia had that really good slide before of kind of what we've got within Ramsay. But like I said, the scope of practice of a pharmacist is changing all the time. And that's probably the most exciting thing about being in this career, is that you really don't know where you'll end up. for instance, like I said, I really, like when I finished my residency, it was all about oncology, and that's really where I wanted to go, but then kind of had other things thrown at me, especially things like pain management and more in the intensive care and like post-operative sort of space. And that's where I've ended up doing my PhD. So it's always moving, it's always changing, which is great, and that's exciting. And there's so many different paths you can go down depending on what you're interested in. I was always interested in the academic side of things. So of course I've gone down the path of research and doing my PhD. I think I always saw my end goal as maybe being like a university lecturer or something like that. So I just little steps towards getting to that point. But in terms of other things, you know, if you're really interested in like clinical pharmacy, so maybe working in a hospital, there's so many different specialties within our hospitals. You know, as you saw, we've got heaps of sites all around Australia, and each hospital is slightly different. So we might not do the same thing everywhere. We've got hospitals where they really specialize in cardiology, some that really specialize in rehabilitation, mental health, all of that. So that sort of things is, I guess, hospital-wise, depending on what you like and what you're interested in, there's heaps. It might be in a particular area of therapeutics. It might be more about management and leadership. And of course, you've got lots of different avenues to go down that. You've got your pharmacists in charge at each site, and then you've got area managers, and then it all goes up. And our chief operating officer is a pharmacist too, so which is really cool. And so it means that you can really step by step see where the end goal is, and you can keep going there. Within community, I think that space especially in the last 2 years with the pandemic and everything, has just changed massively. And there's so many different new things opening up, especially within the aged care space at the moment. That's a big hot topic. So you can go down that, you know, anything within that path. And then I guess overarching, things like going back to uni and maybe studying a different thing, a master's, or even going into your PhD. And I was surprised how easy it was to find a PhD. So there's always people looking for things. So if that's something that you see yourself, it's don't be daunted by it, and go for it. So yeah, I think that's it. Is really there's so much going on, and whatever you come up with, there might be something out there for it. We've had a pharmacist express interest in, you know, radio pharmaceuticals. And I was like, I don't know how to help you get there, but we'll see what we can do. You know, if there's a course and things, it's not something that we particularly offer, but there's just an insane amount that you can do. So it's really exciting.
Sounds like there's a bunch of opportunities. Sounds super exciting. Okay, so on to the next question. This is for Alicia. So the question is, what can interns do to stand out during the interview process? / what are you looking for in interns?
Yeah, that's an interesting one. How do you stand out in an interview? I guess these days we're online, so making sure that you have your, you know, get online at the right time, and you're diligent with turning up and responding to emails and requests. So making sure you've got that sort of digital space happening for yourself. And then standing out with regards to your responses, where they're measured, accurate, and thoughtful. So making sure that you're thinking about who and why the question is being asked, and who to and what about. So, you know, if we're talking about how you had an interaction with other staff members, you need to be honest, as well as express how it is for you. So your clinical knowledge isn't as important as maybe you think it is with regards to the interview process. It's more about having the right people and being in the right team. So that's how you'll stand out, being an awesome person during the interview process. And of course, answering any clinical questions correctly. On your applications, if you're applying for somewhere that's not maybe where your address is, then it's much better to tell us why that you'd like to apply to the different site. So are you going to be moving? Have you applied for Queensland and you live in Sydney? Is that because you want to move to sunny Queensland and you really want to live in a particular spot? Or is it because you've just applied everywhere and you're just hedging your bets? So just stand out. Tell us why you'd like to be there. know what the company does and what that hospital specializes in. Because if you're applying for a facility that just looks after mental health and you're not interested in mental health, then you're not going to stand out in that interview process.
Awesome, thanks so much. And if you guys are looking for, any extra interview preparation tips, you can also check out our website. So Grad Australia, we actually have like a whole area dedicated towards interviews and just how to stand out, things to do. So definitely check that out because I think that's super handy and it's something that I wish I had when I was a graduate or back in the internship days. So Jasmine, it's time to ask you some questions now. So the first question I have for you, Jasmine, is what are the first few months like as an intern pharmacist?
So when I began my internship, I was so excited and like eagerness to begin my career, and then along with being glad to be out of uni, I felt like is a genuine to be a genuine part of a healthcare community. Now that I'm a pharmacist out of university, when at uni we were role playing to help make believe people. Now we are actually doing the real thing and to help real people, which is fascinating. And I really realized that how much Ramsay is supporting the interns. So I was a student when I was working here as a casual, but like now that I'm a full-time worker, they're always giving us some modules to do as a training. They provided us AMH book, which is like so generous of them, and I think we're like one of the luckiest interns. And also like my preceptor, he always he's keep telling me that he has high expectations from me than how I was before, which is a lot challenging. And the biggest thing for me that really opened my eyes was when I began my internship was the amount of how much I learned in a small period of time. So my master, when I did the master course, that was for 2 years. However, like when I started working here, I've learned so much about like a legal requirements of scripts, the common medications that can be used for like a wide variety of treatments that actually can be used for another indications, like such as candesartan. I didn't know it can be used as a prophylaxis for migraine. That's something that I've learned, and I was fascinated about that. And also during my internship, in comparison to when I was working as a casual or student, the senior pharmacists that will guide me towards making important decisions. And however, like now I play an active role in helping the team and also helping the senior pharmacist. So I can feel like how much I have grown since till I was at uni until now. And one challenge thing I've really, and I still don't know how to do it, is when I was a student, always the experienced assistants, they always come to me, they were always supporting me and helping me to make a correct decision. However, now that I'm an intern pharmacist and I've been studying all the time, and I become more experienced, so I sometimes have to correct them, and it's really challenging for me not to sound so rude when I'm trying to telling the senior assistants what to do, which is I'm still working on that. And also, as a student, we have, when we're doing role playing in our OSCE exams, we have a lot of time because the teachers there, they want us to constantly asking questions. However, in a real life, this is not the case. Like we're going to be lucky if the patients would let us ask 2 questions. So a great opportunity that Ramsay gave me, I was working in different areas. So I was working, I'm based in Sydney. So I was working at Bondi, Ramsay Pharmacy, and my intern is in Miranda. In Bondi, all the patients, the young populations, they're all working, they're always in rush. They know better than anyone what they're doing. And so I gotta be quick with asking my questions. But like here, no, because mostly the population here is all old people, and they love to talk. So I don't have that challenge. So for me, being able to work in different areas for the same branch, it really gave me like new skill, which is like I admire that for me to be able to prioritize asking questions. And also, one main aspect of Ramsay that I love and I really appreciate it is the job security. So, and the support that they provide us. So, as Alicia mentioned, that Ramsay is such a successful company. So, for me, if I decide to, I have to move out to another city than Sydney, I have a job because there's another branch in Ramsay. Or before, I didn't know if I would like to work in the hospital, so that's why I choose community. But now I don't mind. When I hear a little bit about the clinical informations, I change my mind, and thankfully I could mention to the area manager who had a face-to-face interview with me and asking what I want to do in the future. I mentioned it, and they were happy to give that to me, which is really great. So our hands is really open and really secure in Ramsay, and I'm really grateful. University, when I was in my first year university, they selected Ramsay for me as my first workshop, and I've never could live here since then. Like I started my career with Ramsay, and hopefully I can finish it by then. Yeah, that's it.
Awesome. Thanks so much. Sounds very supportive and sounds like you've had a really great experience so far and will continue to do so. Jasmine, I do actually have another question for you. So, my other question is what advice would you give to someone about to commence their internship?
So what I would recommend is don't be shy. You always go to your preceptor and ask and do a lot of role playing, a lot of practicing. I've been lucky with my preceptor because this, whatever that I'm telling you now, he actually taught me all this stuff. So what I would recommend is every week pick a topic in one of the S3 medications, one medical condition, and one drug class from AMH, and talk about one of those to your preceptor, and also like ask. Every Wednesday we do, as Ella mentioned, we have a workshop, and they're giving us past papers exams. We do a lot of role play. So then um, do practice role playing with your preceptor as well. It's because it's really giving you the confidence for the oral exam. The mine is coming in 2 months, and I can't believe it. But all these practices that I've done, all these workshops that they gave us, I feel a lot more confident than when I'm talking to my friends. They're surprised how I feel so relaxed about that. Um, and yeah, in these Wednesdays workshops, apart from just doing a role play, we learning so much about the law and ethics discussions, and then we develop and be developing our problem solvings and communication skill with like allied health professionals like other doctors. These are the little things that I didn't really practice when I was at uni. I never spoke to a doctor. So now that I've got the opportunity to learn, it's amazing in the workshops, and I am practicing that with my preceptor. I know my preceptor wants to call a doctor, I actually volunteer. So can I give them a call? And so that would give me the confidence for the exam. And one thing, it's really important. One of my managers at Bondi, she taught me that. And first, I didn't like it. I was like, gosh, that's too hard. But then I actually did it, and I'm so grateful. So, in beginning of the internship, be on the floor, be more, do a lot of interaction with people, with patients, and do a lot of counseling. If it's a new drug, make sure that we are counseling the patients, or we can walk around the aisles and see if people they're looking for a product. We have to start asking questions of like, is that for yourself? What symptoms do you have? What have you tried? These are the great time for us to practice those questions. And then in the second part of the internship is when we are dispensing, and then we understanding all the legal requirements of the script. And when we are not sure about what drug we are dispensing, if it's quiet, quickly go on AMH, read through about the new drug and educate yourself. And also go through the counseling points. So kind of picture that your preceptor is going to ask you, hey, Jasmine, do you know what medication is? So on that spot, I try to educate myself about the new drug that I just dispensed, which is, I felt it's really good. And one last thing, in our exam, we really need to know how to find our resources. So when we were at university, we always use online resources. We were like doing F commands and finding information quickly. But for the exam, unfortunately, that's not the case. So what I would recommend is when you're having your AMH book during an internship, use the book. Don't use the online version. By the time in October, when it's your exam, you're a lot more faster and you're a lot more, you know how to use this book. You're a lot more confident with how using your book. These are the advices that I can give.
Thanks, Jasmine. I just have one final question for you before we do a round of final advice from everyone. And I'd love to know if there was anything, like any advice or tips that you followed that you think helped you land a internship at Ramsay.
Sorry, your question means like what I wanted and I didn't get?
So my question is, if you were to give advice and tips to someone who wanted to get an internship position at Ramsay, what would you say? Do you have any advice, like, body language, or how they can prepare, or how to make themselves feel more confident when they go into the interviews?
Okay, I got that. So what I realized, not just for me working for different branches. Also, I had a few friends at university that they were working for Ramsay. What I would recommend is the staffs in Ramsay, they're so friendly. They're so supportive. They always want you to be honest with them. So be honest. If you be honest, they will definitely help you. If you tell them that like this is your weakness and you're trying to learn from it, or you're trying to grow from this, let them know. They would definitely help you. And try to enjoy your time when you're doing your internship. Don't be scared. It's actually every day that I'm doing my internship at Ramsay, I'm really enjoying it. I feel like it's a big fun for me to learn, to help, and just be motivated and have that in your mind that even if you're not sure what you're doing, you are with a company that has a lot of opportunities for you in the future. Maybe not this year, next year, or in 10 years, you can do something different, or you can realize what you really like, and then the team will help you to guide you to go there. And I would say fight for it, because working for Ramsay, I feel is really good.
Awesome. Thanks so much. So we're getting to the end of our webinar. So I'd love to do a final round of advice from everyone, and then we can talk about, share some of the open job opportunities as well. So I think we'll start with Ella. Is there any final advice that you'd love to give to any future pharmacists out there?
Probably the biggest, well, I've already said, say yes to things and just go for it. But the biggest thing is just to don't think that anything's out of your reach. It's always possible. You just have to ask for it and tell people that you want it and work hard towards getting there. I don't think, if you asked me about 5 years ago if I thought I would see myself in this job right now, I probably would have said probably not for another 15, 20 years. But it's here. So just work hard and keep going for it.
Thanks, Ella, and I'll pass it to Alicia. Oh, there we go.
My final piece is that you need to care for yourself as well as others. So make sure that your work-life balance is what you want it to be, because that's super important in life. That whilst we all work to live, we don't want to really live to work. So make sure that you're caring for yourself along the way. And when we go to university and we do a pharmacy degree, when we come out, sometimes it feels like we should have also done a concurrent HR degree. So because we'll then start managing people, and that's a little bit scary. So there's lots of resources and mentors and things to help you manage people, because you will be pharmacist in charge, or in charge of a conversation with a patient, or in charge of looking at, taking a phone call from people. So make sure you develop those HR skills within yourself, but to help your team be better.
Awesome. And Jasmine?
So, as I say, what I would suggest is try to have fun every day when you're going to work, and be a great listener, because you're going to realize that when you're working after a few months, we can actually be a detective as well. So we always have to research, because the patients, they won't give you all the information that you need. So you have to keep searching everywhere, and then you can help. So make sure that you're a great listener. You're always documenting with everything that is happening, because, as I said, you always can refer to your little book to find out more information than what you need, because the patients, that won't tell you. And just enjoy, and just be open to learn. And like when the manager is giving you hard tasks, don't be scared of it. Do it. Like when I was at Bondi, they asked me to do QCPP, and I was like, what the hell is that? I've never done it. I was just a uni student. But then I realized that, gosh, I'm actually getting a credit for a pharmacy from government. Like, how important would that be? Like, so always volunteer to learn, and you will be successful.
Love that. I feel like we've got so much inspiring, motivational tips and advice from all of you. So thanks so much. I think the last thing to share is the opportunities available. So, the open internship positions. So would either one of you like to, who would like to discuss that?
Oh, I can. I can do it. So currently we have over 50 opportunities. We have them all up separately so that you can have a look at the different types of opportunities, where we have straight community pharmacy roles. We have combination roles, especially in Victoria, where it would be sort of 6 months at one hospital, 6 months at another hospital. We have community pharmacies that are in the foyers of our facilities. We also have cancer care specific internships at some of our bigger hospitals, especially in Sydney and in Queensland. And then we have regional opportunities. So we have Rockhampton, Grafton, Cairns, which all attract extra money from the government as well. So there's some interesting new payments for internships that are classified in the rural sector. So that includes Wangaratta and Coffs Harbour, where the government are actually sponsoring the intern as well as the business to have those rural opportunities. So I encourage you to have a think about some of those rural opportunities, because you do get to escalate your career faster than you would into a bigger hospital or a bigger community pharmacy, because you'll be in charge faster. And if that's something, and you're also will probably know the names of your patients or customers quicker, because you have lots of regulars in those smaller community that are more rural. So they're all our opportunities. Thanks, Emily.
Awesome. Well, thanks everyone. So yeah, make sure you go check out those opportunities. We've got the link just here. You can on this link as well. So it's their career profile on Grad Australia. There's also a bunch of other things. So there is like other videos, there's day in a life, there's blog posts, advice articles. There's really so much. So if you're wanting, any further knowledge or advice, then it's definitely the place to go. And it'll also give you a really good view of Ramsay. So on that note, our webinar today has officially finished. That was the end of all our questions. So I hope you guys all found that useful, and thank you so much to our 3 speakers for coming on board. It was really awesome to hear all your different perspective. So for those of you who have not signed up yet to Grad Australia, make sure you do so. Create an account. That way you'll get notified about open job opportunities. You'll also get notified of events we have, just like these. We have a bunch of them coming up. We host these webinars about 2 to 1 times a week, and we have them on all different kinds of topics. So make sure you share it with your friends as well, because we do a bunch in like all kinds of industry, like tech, law, engineering. So if you want to help your friends get ahead in their careers, then definitely share it with them, and check out our socials as well, where we post all the upcoming webinars and advice we have from real world industry professionals like all our speakers here today. So yeah, that was the end of today's session. And if you guys want to watch this back, just head to YouTube or head to Ramsay's career profile on Grad Australia, and you can watch this video as well as all the other past videos and blog posts that we've done with them. So thanks so much for everyone for tuning in, and we'll see you next time.